anything bothering you in particular, pain-wise, body-wise. If not, I'll go rogue. All right. And feel free to, stop me or ask any questions. I'm sure it will also help somebody else too. So what I had in mind today was, since it's the last one of this month, so we're a little bit more experienced. We're not gonna spend as much time as the review, but we're still gonna go through it a little bit, and then we're gonna add some exercises with that, and then definitely at the end, still gonna save time for any questions. I might even at the end bring up urinary incontinence, just because I know people struggle with it. And even if you don't struggle with it now, it could be something that presents later. So I'm gonna explain how to prevent it a little bit, or if it's happening, how to maybe correct it a little bit. I'm also gonna try to touch base on some pelvic pain issues as well that could be going on as well. So we'll save some time for the end. So if you think of anything that's maybe going on body-wise and you have any questions, definitely feel free to ask. And if there's anything in particular that you want to work on, let me know before it's over, so that way we can show it. But if you're ready, go ahead and let's start in cat-cow. So we'll start hands and knees, since we're a little more familiar with the breath. And of course, if anything hurts, you don't have to go hands and knees. You can use pillows, you could do things seated, no problem. But we're gonna go ahead and start tabletop, and we're gonna think belly low, tailbone high, chest up and forward. And we're gonna pause here just to check in. See if you can release pelvic floor, soften the muscles in the butt, the belly, the jaw, and take a deep breath into your ribs. And then exhale, blow out a candle, scoop tailbone underneath you. Usually around here is when people try to squeeze their butt and push the mat away. Try not to squeeze your butt. Try to imagine you're scooping and bringing the pelvis towards your nose using your core, but keep the glutes relaxed. And then go ahead and go belly down again, tailbone high, chest up and forward. Let the belly go. Take a breath in, breathe in. Exhale, scoop under. So basically we're using our core here to do the posterior pelvic tilt, which is tailbone under. And then when belly is down and tailbone is high and chest is up and forward, we're in a relaxed position. So this is pelvic floor being relaxed. We're gonna inhale and lengthen further. Exhale, scoop it under. Get a little more activation of pelvic floor anteriorly because we're using our core to scoop our pelvis under. And then a couple more times, belly low, tailbone high. Every little vertebra, thoracic spine, extending, looking up. Let the belly go, take a breath in. And exhale, scoop and push away. This time, shift your weight back. Start to go into child's pose almost. Hips to heels. If your knees hurt, you can put a pillow under your hips. Reach the arms forward. Drop the forehead down. And just notice where you're potentially tensing up. Jaw maybe, belly, butt, shoulders. See if you can let everything go. This is a good check-in for your nervous system. When you start moving around, you start thinking about activating things. Sometimes we just start to grip and grab. So it's good to check in. Try to release. Take a few deep breaths. Bring your hands to the left side of the mat. Maybe knees come together or not. They can stay wide, and shift your body weight. So you're reaching to the left, right arm reaching most to the top left corner, hips to the right. Take a few deep breaths. Usually people feel tightness around the ribcage, armpits. Breathe into there. Come back up, switch sides. Knees to the left, arms to the right. Shift your body weight. Breathe into the armpit, the ribs. Where do you want to grip and grab? Try to relax it. Really good. Coming back up to tabletop. Now, if the wrists bug you, feel free to do this one on the forearms. I kind of like it on the forearms too. So I'm going to show it forearms for a little bit, and then I'm going to go back to tabletop, but you can do it either way. And if that's too much, let me know because I have another modification. But we're going to go ahead and keep our weight on the right forearm. Weave the left arm through, head drops. Barely any weight in the head, it's really supporting the shoulders. Imagine you're breathing into your butt. You see how we're like at an angle right now? Pelvic floor is being assisted with gravity coming up. Usually it's fighting to stay up, and now we're helping it. Just imagine you're breathing into that space that's being stretched, mid, back, hips. Exhale, let everything sigh back up and in. Pelvic floor rises. Inhale one more time. And exhale. Feel everything come back up and in. Belly comes back up and in. Rib cages collapse. One more time. Inhale. And exhale. Start to come up. Reach this arm up and over. Get a nice little stretch in the chest. Drop that hand down. Switch it out. So now left hand down. Weave the right arm through. Same thing. Resting the head. Breathe all the way to your butt. I know it sounds silly, but imagine the air is traveling in through the nose, throat, ribs, belly, pelvis, butt. And exhale, imagine it's all coming back up, in, collapsing, breathe in. Belly, all the way to belly, butt. And exhale, soften. Allow everything to come back up and in. Rib cage collapses, chest falls. Inhale in through the nose. And exhale, sigh it out or blow out a candle. One more time, inhale. And as you exhale, pull belly button up and in, come back to forearms or tabletop. Okay, great. So now come back to tabletop if you can. And we're gonna go into our bird dogs, which is what we left off kind of last time. And so I want you to push the mat away, because sometimes what happens is we sink into our shoulders. So fingertips are gripping the ground, that helps with the wrists. Push the mat away. Round your mid back just a little bit and scoop tailbone underneath it. Your back should be flat. Sometimes I even take one of my hands in this position, move it around my lower back because that's usually where people collapse in. Okay, it feels nice and neutral. I'm not too rounded. Now we're going to stay in this position, but keep belly so soft. So spine is straight, belly is soft. Sigh out everything. Now keep belly soft. Don't pull in as you inhale. So inhale through the nose, rib cage expands. Belly expands. Exhale, pull belly button to spine like a zipper from the pubic bone up to the belly button. Feel the lower belly come up and in. Hold for a few seconds. Now you're holding. You should feel pelvic floor contract just a little bit. Keep breathing in and out through your nose lightly. You're not holding your breath. Reach forward with the right arm. You shouldn't have lost pressure in the lower belly. You should feel a little more tension there. You're thinking about pulling, pulling, pulling. Keep reaching with the right. Slide the left leg straight and either keep it there, or if you want to challenge yourself, that's when you would bring the leg back up with the arm, pulling belly button to spine. Don't hold your breath. Reach, reach, reach. Drop the arm, drop the leg. Really good. And then when you're back in tabletop, same thing. If you need to take a break at any point, just go to child pose, take the pressure off the wrist, sit up, whatever you want to do. So now we're in tabletop again. Relax the belly. Breathe in through the nose. Exhale. Pull belly button up and in. Pubic bone to belly button. Hold that tension there. Keep pushing the mat away. Reach forward with the left arm. Slide the right leg. Point and lift leg or leave it there. Keep reaching. Keep pushing the mat away. Tuck the chin a little bit. Scoop tailbone underneath, feel lower belly activate. Pelvic floor is pulled in slightly. It's not pushing. Drop the arm, drop the leg, and shake it out. You can flip your wrists over just for a little wrist stretch. Change it up a little bit. Shake your hips left and right. But what you should have felt is that, okay, at rest, I was rested. Then I was able to pull my lower abdominals in and maintain that pressure when I added load, which is with the arm or with the leg, okay? So we're gonna do that again, but this time we're gonna add a little crunch with it. You do not have to do it, and I'm gonna show it real quick, but basically I'm gonna cue all the same things. You're gonna reach the arm forward, you're gonna reach the leg, right? Or slide the leg. You can keep it down, you don't have to lift it. But let's say you kept it down, you're going to curl so that leg is dragging. You're gonna curl and push. This is hard because, not because of this motion, but what ends up happening is when we come together, sometimes we push belly out while we're trying to use our abs. And what we're trying to do is keep the belly pulled in like our zipper and then curling in. So none of the belly still stays soft. Nothing is getting pushed out. So focus on that. When you go out, you're still pulled in. Stay pulled in, curl into yourself. And then we're going to extend back out and drop. Hopefully that makes sense. If it doesn't feel right, skip the crunch. Just extend. Okay? So back to tabletop. Belly soft. Inhale into the ribs. Blow out a candle. Scoop tailbone underneath. Just slightly think about the belly button to spine. Zipper. Reach the left arm. Slide the right leg. Keep the tension there. If you feel good, lift the leg. If you feel good, curl inward. Push the mat away. Opposite elbow, opposite knee. Extend back out. Drop the arm, drop the leg. Come back to tabletop. Relax the belly, shake the hips out. Don't stay in tension. Opposite side, we're gonna stay in tabletop. Relax the belly. Inhale, fill. Exhale, hug. Belly to spine, reach with the right arm, slide with the left leg. Lift the leg if you want, or keep it down. Reach, reach, reach. If you feel good, go ahead and slowly start to tuck, round the pelvis, curl inward, opposite elbow, opposite knee. And then go ahead and extend. And then bring it down. Wide leg child pose, take a little break. Hips to heels, forehead down. And just do a little self check-in. How did you feel with that? Because if you felt like, okay, easy, great. Because what we're gonna do is we're gonna do this with less breaks. If you felt like, okay, that was challenging, but I could do it, take your time, slow down, take a break. You don't have to keep going. You could go slower than I say, faster than I say, but try to really pay attention to how your body feels. Okay, so back to tabletop. Okay, so one thing I'm gonna add to that I didn't cue is I like to push the tops of my feet down into the mat when I'm in tabletop, and that automatically kind of gives my core a little activation, but also takes pressure off my knees. So it's not like the toes are down, it's like I point the toes, relax on top of the mat. Okay, and then I'm gonna keep belly soft, unless it hurts, then don't do it. Belly soft, inhale. Exhale, hug. Belly to spine. Reach forward with the right arm, slide the left leg, point and lift if you want, curl inward. One touch, extend back out. Take a break here or curl again. We're gonna try to go for 5. You don't have to. You're breathing small sips of air the whole time. 3, elbows touch. And then reach, reach, reach. Keep pulling, scoop tailbone underneath you. 4. One more. And 5. Good. Drop back down and take a little break. And that was fast. Mostly because I'm like, I don't want to hold it for a long time. But the other option is, and I love it, is do one so slow, take a break, do another so slow, Take a break. You're learning a new technique. You know, you're trying to think about your form. There's lots of things happening. So it's not like, oh, I have to do 5 quickly. I already did 1. Awesome. Okay. Do whatever feels good for you. These are all just suggestions. Like right now, I'm taking a break. I'm shaking my hips. I feel like it needs it. You could just be on your back. You could just be in child pose, whatever you need. And now we're going to go back to tabletop if you're ready. And we did right arm, left leg 5 times. So now we're going to try for 5 on the left arm, right leg. So tabletop. Push the mat away. Tops of the feet press down. Sigh, belly out. Inhale, keep belly soft. Exhale, slowly hug belly to spine. From the bottom up. Maybe you tilt the ribs just a little bit. Scoop tailbone underneath just a little bit. Maybe that helps you feel a little more solid. Go ahead and lift and reach the left arm forward. Slide the right leg. Point and lift. And curl. 1. Extend, keep breathing in and out through the nose. Curl. 2. Extend or slide. You don't have to lift. 3. Reach, reach, reach. You want long body. 4. Reach, reach, reach. Long body. 5. Awesome. Take a break. Relax hips to heels. Forehead down. And if child pose is not comfy anymore, just lay on your back. No big deal. Awesome. Take a break and lay on your side if you feel comfortable. We're going to throw in a little bit of hips that we did partially last time, but really the time before. And then we're going to make it maybe the same or maybe harder. I'm not sure. We'll see. But I also would like to try to do a side plank with you guys. It's not like a full side plank, but I feel like it's a great place to kind of work on your obliques, your lateral trunk stabilizers, a little bit of rotation too. So there's options here. And I would say really consider just staying on the first level of this, just so you could which is basically like this. My elbow is a little bit tucked under, not quite under my shoulder, a little more tucked in, because then when I push the mat away, my shoulder now is perfectly in line. My palm is down, chest is open. Ribs sometimes flare here, so we kind of scoop under. And you can challenge it a little bit, getting your hips almost a little away from you, like that. So I almost I push myself up. Sometimes we're really crunched here already, so I've just dropped my hips a little further away. But my legs are still on the ground. This, I would say, is level 1, stay here, okay? Because what you can do is, we're gonna basically, this is relaxed, right? I'm totally relaxed. The second I push into my hip, and let's say your hip hurts, put a pillow there. It's totally fine. Pillow or towel. Push, almost push your hip into the ground, and then push the mat away with your shoulder, and rotate, open the chest open. This is a side plank. It's a level 1, but it's definitely a side plank, right? You can hold this because this would be relaxed. So just us pushing the mat away, we're activating some muscles here. We can make it a little bit more intense by reaching up. And what you could think also is just a little zipper action. Inhale, reach up, look up. Now I don't drop my pelvis or my trunk, but I start to curl, rotate inward, and rotate back up and out. Rotate inward, feel a nice stretch, and rotate back out. If you want to stay at this level, but you want to challenge maybe a little bit more, all you do is top leg extends out while you do this. If it's too easy, which sometimes, although it feels easy, it's not, because you're working on coordination, right? But if it is, then you push through. and you elevate the hips. And you curl in. I'm gonna do hips down. And I know for a fact that my hip bone is bothering me, that if I was home, I would just get a towel and put it on my hip bone or a pillow. Because my body's not used to like withstanding that pressure on that bone. Okay, amazing. So I wanted to show that. That's one basic way to do obliques. There's another way that we're gonna do it laying on our back. But I want to show that on one side. If you can, stay on this side for a second because we're gonna do the hip series. If you need to swap it out, go ahead and do it. Why don't we do that anyway? Let's just swap it out just in case that's like a lot of pressure. We're gonna go back to, we're gonna do the same thing, but we're gonna change sides. Let's just do that so we can take a break. So I'm gonna stay on the same side so you can see me better. Try to swap. Okay. So fetal position. So you can start kind of all the way down if you want. Fetal position. Push yourself up. This arm is a little bit underneath your shoulder towards your trunk, because when you push away, now the shoulder is directly under, the elbow's directly under the shoulder. Knees are stacked, hips are stacked. My ribs are not flared, they're a little tucked under. I'm thinking about pulling puke bone just a little bit towards my nose. Get a little lower belly activation. I'm gonna reach up, look up, keep pushing the mat away. Make tight, tight, tight circles. Come in and come out. Maybe you inhale, reach. Exhale, curl in. Maybe the curl feels like I can't curl or rotate. That's okay. That probably means there's some tightness in your thoracic spine. Inhale, reach. And exhale, rotate, curl. That will improve with time. Your tiny muscles, maybe you don't work often. Reach up, exhale, curl in. A couple more, inhale, reach. Exhale, curl in. This is also a lot of stress on the shoulder if you're not used to it. So please take a break if you need to. It's just as much a shoulder workout. And weave through. One more. And weave through. Really good. Take a little break from the arms. Shake it out. Okay, now we're gonna lay on the opposite hip where we first started. And we're gonna do a little bit of hip strengthening, the one that kind of burns. Okay, so fetal position. We're gonna start with our clamshells. We did this one last time. Hips and heels stacked. Don't worry about how high up you go in the clamshell. What you don't want is to rotate your whole trunk to make this happen. You're just bringing the knee up, squeezing the butt, calming back down. Knee up, squeezing the butt, calming back down. And while we're doing this, my hand, I like to be here just so I know that I'm not rotating. But also, I like to make sure that, okay, as my leg gets heavy and I'm lifting it up, I'm not pushing my belly into my hand. It's just slightly drawn in, taking small sips of air. Maybe I'm inhaling through my nose, out through my nose. If I feel like my heart rate's a little high and starting to breathe heavier, it's fine to breathe out through the mouth. Okay. Now, keep knees together. And now you're gonna rotate, bring the heel up, opposite direction. Really good. Getting our hips stronger and supports our pelvis so much. Takes stress off. Even just activate these tiny muscles. Just starts to take stress and pressure off pelvic floor, because pelvic floor is usually overworked and it just presents a little weak, but it's usually because it's overworked. Now stay in this position, right? Flex the toes towards your face. And now kick back, karate kick, and bring it back to the same spot. Kick back and behind you, drive that heel, squeeze the butt, come back down to touch. So you're basically kicking in the direction that your leg is facing. So it's a little bit of straight up to the ceiling and a little bit of back behind you. So it's a combo move. Good. And if you forget the movement, just come back to internal rotation like this. So you know you're trying to like kick and lift the ceiling up. You should feel burn right on the side of your butt. If it's in your quad, it's because you're not rotated enough. Really good. This one is really difficult in the sense that it burns, so one more. Good. Now bring that whole leg down straight. Rotate your toes if you can, either parallel or down so that your toes are down, your heels up. Keep the thigh in line with your trunk, or if not a little bit more, start to squeeze your butt so that the leg draws back, and now lift it straight up. 1, 2, make sure you're not pushing pelvic floor out or belly out to do this. 4, 5, so my hand is there to remind myself a little bit. 7, 8, 9, 10, try and go to 12, 11, and 12. Bring it down. I like to do this. You don't have to, but I like it. Okay, now we're gonna take this top leg. If you have a pillow, if you don't, it's not, what you can do is just bring the leg out in front of you and rest it. If you have a pillow, I kind of like to put the pillow under my leg, just keep my pelvis a little more neutral. And then the bottom leg is gonna be straight. I'm gonna take this off so you can see it. The bottom leg is gonna be straight. You point the toe and we're gonna lift it up. Belly up and in, lift the leg up. Belly up and in, lift the leg up. If this hurts or you feel like a strong pull at your pubic bone, skip it. If it's just difficult, keep doing it. So bottom leg is coming up. Bottom leg is straight and coming up. Yeah. And take a break. Go ahead and lay on your back. And we're gonna do our bridges. Okay. If you guys need me to take a break, please tell me. Okay. So, excuse me. Okay, so lay on your back. Start to do a couple relaxing breaths. Soften belly. One of the legs might be burning a little bit. Makes sense. Take deep breaths into the ribs. If your lower back hurts in this position, what I usually do is I bridge up a little bit, do a posterior pelvic tilt, and land on top of your butt. If you're on top of your butt cheeks, it kind of helps take a little pressure off the lower back. Okay, one more deep breath. And then what we're gonna do is we're gonna practice our posterior pelvic tilt for a second. And hopefully you remember how to do that. So we're gonna do posterior pelvic tilt. So we're pressing the lumbar spine into the mat, reaching your spine closer to the mat, pubic bone slid up towards the nose. Keep that position. Tilt rib cage down if you can, and push weight in your feet and bring the hips up. Thinking about your zipper, you shouldn't be pushing belly to the ceiling. It should be nice and pulled in, and bring it down. Soften belly, relax the glutes, breathe in through the nose. Exhale, start to posterior pelvic tilt, tilt the rib cage down, pull belly button into spine, lift the hips up. So we're doing a little bit all at once. It's okay if you don't do it 100% right. Drop the hips back down, untuck the pelvis, relax the belly, inhale through the nose. Exhale, scoop, tilt ribs, lift hips. Very good. Bring it back down. Relax the belly. Take a breath in. Exhale, scoop. Tilt. Hips up. Come back down. Relax the belly, inhale. Exhale, zipper, tilt, hips up. See if you can squeeze your butt a little more. Feel the tops or the fronts of your hips. Stretch a little bit and then come back down. Last one, big inhale. And exhale, scoop, tilt, come up. Awesome. All right, go ahead and roll to the side. We haven't worked yet. So we're gonna go back to our fetal position to do our clamshells. Hopefully that doesn't hurt your back or anything like that. If it's a little achy, that might be okay. Sometimes it's the stiffness. If it doesn't feel good, like tomorrow or that night, that's something you might want to share with me. Okay, so clamshells, hand at the belly, and we come back up. You'd be surprised doing this series fully, like a few times a week. Your hips start to feel so much stronger, more awake and balanced when you start walking and squatting and things like that. Because these are muscles we really don't pay attention to during the week. And so when they're alive, you feel it. A few more. Making sure we're not pushing pelvic floor out. Taking breaths. Really good. Last one. Awesome. Now we're going to keep the knee there. Bring the heel up and back down. Heel up and back down. So similar burn, different spot. Usually lower intensity. This is called a reverse clamshell. And like I know in the video, potentially you're like, wow, maybe you're not that impressed, but my heel's coming up quite a bit. Before I first started this, I was like this. I could barely get it off. So really with practice, it really does improve. You get more mobility in the hip, more strength, more coordination. It didn't just happen for me either. Okay, last one, hold at the top if you can. Flex toes towards your face, kick back and up towards the wall behind you. And bring it back down. Kick back and up. And bring it back down. This one burns if you're doing it right. Better to do 1 or 5 really well. Where you're like, okay, I did 1, but I fully extended that knee, squeezed my butt, kicked, and then came back down. That's totally fine. Rest as much as you need in between the reps. Kick back up. Oh yeah. Feel extra sore today. Kick back behind you. Couple more. And then that last one, we're going to keep the leg straight and lower it. So kick one more. Keep that leg up and bring it down. So now toes are either parallel, facing down. Leg is long. Belly is in. And we're lifting up for 1, 2. I cannot believe we did 12 last time. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Oof, regret. Outside is tight bringing. Okay, so top leg either rested on a pillow or rested on the ground. Bottom leg is straight. And that top leg is going to stay rested. The bottom leg is straight in line with your trunk. And we're going to lift it up and down. Knee is straight. If you feel strong, pull at the pubic bone, which is up in the front. Do not force it. It might be too heavy, too much strain there. You don't want to hurt yourself. Maybe it's something you're like, oh, I'm just going to initiate the movement by lifting the leg up. That's fine too. You also lay on your back and squeeze a ball, a block, a pillow. Work on squeezing the legs together at first. This might be too hard. And then take a break. Really good. Okay, before we stretch, because we are going to stretch, I want to try to do a couple things in standing. I know we briefly discussed the squatting, so I'd like to try it again, and we'll time it with pelvic floor and core coordination. It's possible I can't do it fully because I'm in this cool little alcove, but it's very short. But I'm going to talk you through it. I'm going to show you the movements, but don't look exactly like me if I'm not fully going to be able to stand up. Okay, actually I could also move. No. Okay, so we're gonna stand, okay? And if you remember, what we did last time was we really practiced our hip hinge, which meant it was butt to wall, right? And then we stood up fully. Oh my God, I have not realize how tight this is. Okay, and then we stood up fully, right? Let's see if Jared can mimic it. And Jared, can I use you as an example since you have a full wall? So Jared's up there, okay? So she's gonna pretend that there's a wall behind her, and back is gonna stay straight, and all you're gonna do is bring your butt back, like there's a chair behind you, keep their knees, see how her knees barely slide forward, and then come back up. So it's not about how low you get, we're really just trying to practice the hip hinge. So let's say you see her knees start to slide forward, stop before that even happens, come back up. So focus mostly on the butt going back. You're shifting your weight, think big toe down and come right back up. Yeah. But back chest goes down a little bit and come right back up. Yeah, so the key is the further your weight goes back, like your butt goes back, the less pressure on the knees. Now, the skill is, okay, I need to feel balanced to do that. So just don't worry about how far back you go. So keep going. And then let's just get that movement down, and I'm gonna throw in the cues. And another way to practice this too, like on your own, right, if you don't have this, is you just get right up against the wall, and you literally take maybe a foot away from the wall or less, and you just bring your butt to touch the wall, bring it back up, bring your butt, touch the wall, bring it back up. Or you do it in the couch, you do it in a stable chair, because that motion of, okay, there's a chair behind me is familiar, but in space we get confused. And now check in with your toes, because the feet are really important for pelvic floor. Am I curling my toes? Can I relax them? Can I think big toe down? Make sure I'm not just like crunching my toes to balance myself. That might be something we have to work on too. Good. And then when you come up, think hips forward. Boom, just bring your hips forward when you come up. Yeah. Last one without my cueing, because you guys are doing really good. So stand at the top, relax everything. So the coordination, this is not a rule, but this is where I start people. So don't think this is how I should lift, this is how I should use my pelvic floor. This is just a basic movement. It's different for everyone as things get more skilled or progress, but this is how we're gonna show it for day one. It's not an absolute rule. So we're gonna inhale as we go down, and we're gonna exhale as we come up. Very simple. In through the nose as you go down, exhale as you come up, blow out a candle. And that coordinates or correlates with everything we've done before, where inhale is kind of relaxed, exhale we zipper up, pelvic floor is whoop, and we stand up. So basically our lift or our come up is our effort part, and that's when we're gonna focus on pelvic floor and core. So don't worry about what happens when you go down, focus on getting the butt back and inhaling. So go ahead and butt back, inhale. Blow out a candle, pull belly button to spine as you stand up. Relax belly, let pelvic floor go. So it might make sense for you to focus only on the core as you come up. Pull belly button to spine as you exhale. And when you're all the way up, if you're like, I don't know if my pelvic floor contracted or not, what you should do is stop, let belly go, let pelvic floor go, And if you felt it drop, then you know it was on. So that's the trick. And you should, in this moment, because you're practicing, relax pelvic floor all the way in between the rep before you start again. Inhale. Start to zipper as you exhale and stand up. And I personally like to pause at the bottom of my squat, so when my butt is back, start to exhale first, zipper, and then come up. So it's almost like it happens right before you come up, so you're already in the movement. Really good. And then always take a second to pause, let pelvic floor go, let belly go, so you know, okay, pelvic floor was on. I did it correctly because I felt my muscles relax inside, which you should be familiar with because of the elevator stuff we were doing before, where you remember, okay, a key goes all the way at the top, which you may not feel during the squat, but you'll feel the release. You'll feel it travel down. And if you felt it travel down, then you know, okay, I activated my core, my breath was good, pelvic floor was supported. Amazing. This is very similar to a bridge, it's just in the air. Let's try maybe just a few more to get it down. Maybe you work on butt going back more and you're like, do I feel my core as I come up? So good. This is the hardest thing to learn, I swear. Just like the hip hinging. But once you get it, and you guys are doing really well, once you get it, it starts to make more sense, and then you can work on depth and speed and adding weight and other things. But this is a very basic functional movement, and the more you work on it, the easier other things get. Amazing. One more great one. And we're gonna stretch. Awesome. Thank you for trying that. Thank you for demoing, Dre, because I'm in a cave. Okay. A very cute cave, but I'm in a cave. Okay. So let's lay on our back. And we're going to do some stretches. I feel like we really tackled all the stuff, but more quickly than we had before, which is great. So let's do a single knee to chest stretch. Go ahead and bring your right knee up and around rib cage. Pull to shoulder with both hands, grabbing the tops of the knee. Left leg is straight out in front of you. Maybe you're starting to press the back of the left knee into the mat just to get a little more stretch in front of that hip. Maybe you're starting to pull right knee to shoulder a little bit more. Maybe you're drawing it out to the side a little bit, so you're kind of avoiding the rib cage. That gives you a little more room. Good. And then go ahead and switch it out to the other side. Really good. And I love doing this with, and I don't have one with me, but I love doing this with like a towel or a yoga stretch strap. I feel like that really helps with a lot of the stretches, because what you don't want is like, I'm straining to grab a muscle, because the key is to like, be relaxed, get a strong, comfortable stretch so your body responds to it. So sometimes just a towel even, add a little length, is helpful. Really good. Now let's go ahead and do happy baby. So you can grab the back of the thighs, kind of like this. You can grab the tops of the knee, and you're trying to go out and back. And then if you're grabbing the behind the knees, just try to relax your legs a little down, let them hang. This is like, eventually you'll be happy baby. Sometimes in the beginning it's like struggling baby. And then take deep breaths. Maybe you rock side to side. Maybe you think about pulling the legs apart a little bit more, only if it doesn't hurt. And then now drop the legs, feet down, knees fall out to the side, butterfly. Really focus on taking your deep, deep breaths here into the ribs, into the lower back, groin. Relax the forehead, jaw, shoulders. Keep them away from your ears. The butt, let it go. Bring both knees together. Let them fall to the right side. Bring the top of your right hand on the left knee. Just kind of left knee or thigh. Just kind of give a little overpressure. Little twist. Look away to the opposite side. See a little twist. Just a gentle twist. Taking deep breaths. Come back to center. Switch it out. Other side. Breathe into the tightness. Notice where you want to clench. See if you can let it go. Come back up. Roll to your side. Carefully push yourself up. Do a seated hamstring stretch. So come equal on your sit bones. Bend your knees as much as you can. Not as much as you can, as much as you need. Chest comes up. So the most important part is this. The legs don't have to be close together. They could be out to the side a little bit. But the most important part is, okay, I'm going to come here and I'm going to try to think chest up. Now that I'm there, I'm going to either grab the back of my calves or I'm going to stay right there. Like maybe right there, I'm like, oh, I feel my hamstrings are ready. But see if you can keep the back straight. Start to slide the legs out in front of you. Knees can stay bent for this. Flex the toes. So I'm going to stop here. My knees are bent. Flex the toes towards your face. Grab the back of the thighs. Back is straight. Or reach out in front like you're going to grab your toes. Maybe you grab the ankles. Maybe you grab the lower leg. And maybe right then and there you're like, I feel my hamstrings. Amazing. If you don't, keep sliding the legs straight. Knees go straight. And just grab a part of your leg. Maybe it's the back. I like the back of the knees, but then my legs are straight. Grabbing the back of the knees. I've got some leverage here. You can think of shoulders down and back. Bend the elbows. Bend the elbows to stretch. Breathe. And very normal to feel like tension up through the spine during this. Because we're working on, okay, flat back and a hip hinge here and hamstring flexibility. So this is definitely a time where your thoracic spine goes, whoa, no thanks. And we're going to say yes, yes ma'am. And now go ahead and relax. Now just round down. Do the opposite. Maybe grab the ankle, just relax the spine. Let it flex, let it round. Drop the head. Breathe into the stickiness, the tightness. Maybe it's in your armpits. Maybe it's in the mid-back, lower back. One more deep breath. Pull belly button to spine. Slowly stack your spine one by one by one. And then shake it out. Now we're going to do a little rotation. Bring your arms out in front of you. Open to the right. Reach back. You can bend the right knee. Grab it for leverage. And twist and reach back. Don't hurt yourself. Don't force it. Start to lean back. Reach back. And then come back to center. Swap it out. Open the hands, reach back, bend the left knee, grab the knee. Start to lean back, reach back, spine stays tall and long. Deep, deep breath. And exhale, come back, shake it out. Okay. And now feel free to sit in like butterfly, whatever you want to do. You can do another stretch if I didn't get your favorite one. And then there were two things I wanted to talk about. The first thing was, I forgot the second thing, but I know the first one. Oh no, I remember the second one. Okay, the first one was incontinence. So a lot of people struggle with incontinence. There's two types. I mean, there's technically three, but we'll talk about the two main ones. One of them is I leak when I'm on the way to the restroom. That one, or I leak when I hear water, or I leak when I think about the bathroom. It's not the act of like a cough, sneeze, or jump. It's like out of nowhere or something is happening, okay? I get the urge and I leak, basically. So it's called urge incontinence. That one is typically not because of weakness, although that could be happening, but that one is typically because we've trained our bladder to do this. So it's something that is common, but is not something that needs to be happening. So if that's something that you're struggling with, let me know, because there are steps to do this, and it's very trainable, and you don't have to be very, very strong to not have that. I'm going to talk about stress incontinence because that is a coordination thing, and we've been tackling that during this. So stress incontinence is cough, laugh, or sneeze, jump. I took the wrong step. I went down the step hard. Physical things that cause a leak. So that is usually, not always, because pelvic floor is either, I find it a lot, pelvic floor is tight, and then when something sudden happens, pelvic floor kind of slightly opens, or like you push urine out, right? Versus pelvic floor is chilling, relaxing, responding to pressure, kind of like this. I'm exaggerating, but it contracts and relaxes and responds to pressure, whether that's I'm walking, jogging, stairs, I take a step, it responds to pressure. And then that's when it's doing it properly, it's more like that. Relaxed, contract, relaxed, contract. But if it's tight, when I do things like that, boom, it pushes out. Or boom, I've lost control. Kind of like my bicep. My biceps type, I can't pick something up quickly. I can't relax it quick enough. It's kind of stuck, being a little inefficient. So that's one presentation that happens a lot. The other one is my coordination is off. Similar to how we've been talking about with the belly, where I push my belly out instead of draw it in. Pelvic floor does the same thing. Instead of pelvic floor responding and closing the door and contracting when I need to sneeze or I need to do all those activities that we discussed, it does push instead. So it's just a matter of like, and that happens because maybe it happened one time, or there's many reasons, but a lot of time we cross our legs really, really tight, and we're like, please, please, dear God, don't leak urine. But what ends up happening when we do that is we're clenched everything, and now we have to be strong enough to withstand that pressure so that we don't open the floodgates. When instead, what we should be doing is like, it's called anticipation. It's like, I'm relaxed. I feel kind of like before when we didn't leak ever. I feel it's coming on, and so my muscles start to squeeze a little bit, and then I sneeze, and then the door shuts. So that act of like anticipation, that's what's messed up. We bypassed that. We're squeezing everything, and we're hoping we're strong enough to withstand it. So we have to work on almost trying to be a little bit more relaxed. Do a little, it's like a 25% effort, kind of what we've been doing with our exercise, and then our body does the rest. Belly comes in, pelvic floor contracts. So retraining that is actually what's going to help stop that from happening. So if that's something you're dealing with, that's something that you can think about. You might need a little more assistance to actually, stop that from happening, but I just want you to keep that in mind. That is probably something we'll talk about more. Maybe I'll take a poll or something, but with level 2, because level 2 is going to look similar to what we did today in the sense of like, there's less cueing. I kind of like, not less cueing, but I kind of expect you to know how to relax your pelvic floor, contract your pelvic floor so that we can add load and movement to it. So expect, not that we'll never talk about it from the basics, but expect more of that. Like how we were today, we're like, okay, we've done all of the basics, and so now we're going to it. We're like adding more skills, learning more things, but it's still not like, oh, I'm lifting 50 pounds off the ground, which might be something later on. Now with pain is tricky. A lot of my patients come to me because, this was the second thing I wanted to talk about, but a lot of people come to me because they're having, I would say there's so many different reasons for pain, but let's say painful intercourse or painful exams, things like that. There's a lot that, not a lot, but it's not one thing that is going on with that typically. One, it could be trauma related, whether that's a medical trauma or, you know, another type of trauma. And so what happens is your body recognizes it, or just the trauma of having pain. And so now your body kind of recognizes this pattern and it anticipates pain. And what we know about that is that our body tends to do this when we're nervous about something happening. And when that happens, let's say it's painful intercourse, if you're trying to have intercourse and your body is like this, it's typically not going to be pain-free. It's supposed to be relaxed, welcoming, you know, I'm ready for this, I'm very aroused, or I'm having intercourse not aroused yet. And, you know, there's so many layers to this, but just to keep in mind that, like, painful intercourse is something that can definitely be resolved. It's not something that is just your thing or what's going on. Pain with medical exams is something that could definitely be resolved. Post-surgical pain is something that can definitely be resolved. And the treatment sometimes looks all very similar. It's a lot of pelvic floor relaxation exercises, maybe it's dilator treatments, a lot of hands-on myofascial work, soft tissue work, things like that. But if you have questions about anything, please bring it up to me now. I'm happy to answer it. If you want to message me privately, feel free to do that too. My personal email, it should be in this Google invite. But if you want the info at kindbodies.com, also you could ask for mine, and you can, because the info one is just for like admin stuff. So if you're trying to ask a clinical question, go for Kristen at kindbodies.com. If you have any questions, this is the last one of the month, and then basically we start over next month. So feel free. Sure. Oh. Mm. Mm. Yes. Yeah, that one's definitely common, and I'm sorry that you had surgery, but I hope you're recovering well. Good. That is typically an easy fix, only because I know it's time consuming, but you definitely want to be seated because your pelvic floor is not fully relaxing if you're hovering, and typically you're pushing. So there could be, even if you don't think you're pushing, you're like, I'm thinking relax, there's this element of stress that's going on. And so when you don't do that, your pelvic floor is not emptying the bladder all the way. And then it's kind of like I push and then I stop, but then when I stand, I push again. So you kind of want, or it didn't empty all the way. There's all those things, but try to put the toilet, plus it's good for your brain because typically we're like rushing and then we're like push and then we like get out. So it's good for your brain to kind of like control the urge. I put the toilet paper down, I sit down, I think, relax, pee, I don't push. I can push my hand on my bladder and lean forward, but I don't want you to push to get the last drop out. That's really common. Think, relax, pee, and then you're done. You can then wipe. Do a tiny, just in the meantime, do a tiny Kegel as you stand up, kind of how you just did the squatting, so that your body knows doors closed, walk away. Don't go back if you have the urge, because your body's gonna be like, oh, I want to do that last little thing, because it's now that it's used to it. Don't go back as best as you can. Do a couple Kegels to send a signal to your bladder you're done, and just go. Yeah. Yes. Yeah. And so and I'm playing around with the idea of starting it at 6:30 p.m. just because I feel like 7 is hard. But is 6:30 good for you by any chance? Or okay. I'm gonna play around with it, see what happens. I'm gonna do it the first time and see what happens. But yes, so Thursdays at 6:30 or 7, it's gonna pop up. I'm gonna start right back from the beginning. So what you could do is you could do a couple of like session 1, session 2, and then you could either, if you're like, you know what, I want to keep going level 1, finish it off, or you could pick up level 2, or pick it up the next round, because basically every month I'm gonna do level 1, and now I'm starting level 2. So you can a la carte pick and choose, stop a different month, whatever you want. Yeah, no problem. Thank you for joining. Okay, and then feel free to email me if you have any questions that come up or you want more private. But it was nice to see you guys, and hopefully I'll see you next week, next month. Bye, Kenya. Bye, guys. Good night.